Welcome to Full Frontal. I'm Samantha B. As we get closer to this year's midterms, Republicans have been raising the volume on their culture wars across the nation, which is crazy because the previous volume was this. Republicans love to manufacture controversies that send their base into a frenzy that will eventually, I'm sure, lead them to burn someone in a wicker man to get a better vote harvest. Unsurprisingly, though, conservatives are also scaring their base by leaning into that classic racist rhetoric, the war on drugs.
A first-of-its-kind federal grant intended to fight the opioid crisis quickly became the subject of a right-wing conspiracy campaign last week, peddled by all of the usual suspects.
This administration is now going to spend $30 million from hardworking taxpayers on buying crack pipes for drug addicts.
Joe Biden's HHS are going to distribute crack pipes for free to addicts across the country.
Joe Biden's latest idea is to pay black people to smoke more crack.
We're not sure if this was Hunter's idea or Joe's way of getting his cartel partners to trust him.
No, Jesse, actually, it was your mom's idea. But while Republicans are acting like the Biden administration's harm reduction grant would basically be a gift card to Drugs R Us, the truth is far less stupid.
$30 million are being invested by the Biden-Harris administration to support drug harm reduction services that include treatment, prevention, but also syringe exchanges and smoking kits.
This is historic in nature because we've been dealing with the overdose crisis for so long, and the federal government has not invested in the public health infrastructure that we need. So this is really about giving resources to overburdened, under-resourced nonprofits that we know will lower the incidence of drug use, and we also know works to reduce the likelihood of people overdosing.
On one hand, this would be a first-of-its-kind federal grant that would pay for harm reduction tools to help save the lives of people suffering from addiction. On the other, this goes against the official Republican drug policy of go f*** yourself. Or as that campaign was called in the 80s, just say go f*** yourself. The harm reduction grant was actually announced back in December, but Republicans are just now flipping out because of a recent article in the Washington Free Beacon titled "Biden Admin to Fund Crack Pipe Distribution to Advance Racial Equity." This headline is naturally grossly misleading, both in that it isn't accurate according to officials and in that the Washington Free Beacon looks like it's just some asshole's shitty blog. You know the goal isn't to get as many fonts as possible on one page, right? Okay. For their part, the White House and the Department of Health and Human Services claim that funding crack pipes isn't part of the program and that it never even was. But rather than kowtowing to Republicans, Democrats should be focused on something even more important. Harm reduction actually works during a time when we need it to work. Drug overdose deaths have increased by 28.5% over the previous year. Look, I hate to call it early, but I think America's 40-year-long program of having a dog in an overcoat threatening to bite children who take drugs isn't paying dividends. But for those still struggling to understand, harm reduction is simply an evidence-based approach to reducing the negative impacts of drug and alcohol use, including everything from overdoses to infections.
This is one of the harm reduction kits that we carry out on the streets with us, and we have prophylactics in here. We have Band-Aids, alcohol pads. We also have fentanyl testing strips, so you can test for fentanyl. We have Narcan, which is an opioid overdose reversal medication. We also have a pamphlet on preventing AIDS and STDs. But we also give them cards with a list of detoxes that are locally in the local area.
Research shows harm reduction tools are critical in helping drug users protect themselves. Programs promoting clean syringes are associated with a 50% reduction in incidences of HIV and hepatitis C because they help prevent people from needing to share needles. Also, harm reduction isn't new. These programs have been around since the 1980s, with over 100 overdose prevention sites operating around the world. And you know how many overdose deaths have occurred in those facilities? Zero. So if harm reduction works, then why are Republicans so against it? Because conservatives' ongoing panic over drugs was never about helping people. It was about using racial stereotypes to arrest people of color.
The context of the way in which U.S. drug policy was developed was that there was always, for each drug, a specific racialized link. Hollywood was celebrating cocaine use. At the same time, The police were busy going out into Black communities and sweeping up Black people for small amounts of crack cocaine.
With overwhelming support, Ronald Reagan signed into law an unprecedented array of mandatory minimum sentences for drug crimes. But no drug would receive harsher penalties than crack.
That's insane! Just because something comes in a different form doesn't mean it's worse. Samantha B is no worse than my previous form of Samantha A, and I'll still be just as good when I evolve into my final form of Samantha C. When referencing crack, conservatives know they're appealing to a decades-long racist stereotype that riles up their base. That's the whole point. If they can discredit policies like harm reduction, they can both make Democrats look bad and keep jailing people of color. For them, it's probably just a bonus that rebooting the crack panic will likely lead to more death and suffering. Unfortunately, by hedging their commitment to harm reduction, the Biden administration is inadvertently helping give credence to a bullshit morality about who deserves help. Drug addiction is painful and destructive, both for those suffering from it and for those in their lives. Believe it or not, shaming people, jailing people, and refusing to provide the resources people need to be safe won't suddenly end drug abuse or addiction. And if helping people isn't enough of an argument, do we really want to go back to having to watch PSAs like these?
This is crack.
I really want to let kids know that illegal drugs are bad news.
Yes, David, it's true. Over 100,000 teenagers were admitted into hospitals last year because of drugs.
I care about my body and my health. That's why I would never, ever take illegal drugs. And let's face it, what goes in your body eventually shows up on the outside.
I don't know, Brooke. If that's true, then why isn't the outside of my body covered in Tom Hardy? Ew! I'm so sorry. Thanks for watching. If you'd like to hear more from Full Frontal, like and subscribe. If you'd like to hear some opinions from a man in a lifted truck, leave YouTube on autoplay.